And then the last thing I want to touch about is really excisional surgery. And I think the big issue, and that's like a tummy tuck or a thigh lift or something like that. And that's obviously a much bigger surgery than the other things that we've talked about. And it's a commitment and it's a trade-off. So when you do a procedure like that, you're trading a scar for shape. And sometimes the scar can even be in a visible place, say if we're going to do an excision of some skin on your arms or your thighs. So that's a trade-off that you have to be willing to make. Now in other areas the scar may be visible. We can certainly do a tummy tuck and keep that even within a bikini line. But if you've got significant redundant skin or stretch marks, your only option may be to have excisional surgery, at least until we investigate some of the other technologies that are out there. And then finally, I think as you go out and start to investigate what your options are, it's really important for you to ask questions, and don't be afraid to ask the tough questions to your doctors, like what's your training, how many of these procedures have you done, and generally what's your experience. I mean, I think we all love it when patients ask us a lot of questions, because the more questions you ask on the front end, the easier it is for patients to go through the procedure. And there's just no doubt or questions after the procedure. So don't hesitate to ask any of us here, certainly, but your doctors as you go and talk to them about these different procedures, the tough questions. I think we all appreciate it.